You
get a got it.
Okay. Una kusha una kabo. Me fumble them. These are the Bɔdi Bεttεh Gentri program where we were the presenter to una non-power we know they get paid. We only do one because one bring benefit to the salon community. And this not just restricted to people no more waiting at the diaspora. This is day for everybody, whether you back home or US or Asia or Europe or no matter outside day, as long as you get Zoom, we try for reach everybody. Hopefully in time, the one that we get influence, then be able to push with a lot of reach the wider audience that salon through maybe radio or TV. Either way, we not charge anybody for the program. We just want to make sure say we people that will benefit. Dear me family, them the advice they give also not to an individual advice. If you get any issues where you feel saying a burning issue, do you talk to your doctor or your physician or your medical professional? We now also a general advice number they give for make sure say we people are able to know when for contact doctor or if something they go wrong with them, waiting for do, waiting not for do, and when for contact doctor and how for look after ourselves. Now more with the guinea, we don't give individual medical advice. So because the reason they not say no one do more, but we not get on a medical record for able to say okay, for that able to prescribe something for you or prescribe even an exercise for you. I therefore know you know all your medical record and know which kind advice will give you. So dear we family dear. If I get problem, when I go see a doctor, yeah, so we only try for give now general advice will help you all, and for that we avoid some of the sickness that we can come across. And like what they say before, we now we don't know they get paid now. Voluntary work they do, they dedicate with time, resource, expertise. Most of them people are now, me not worry about me, but most of them people are now don't spend a lot of time for learn. You know, they don't learn, they don't practice in different parts of medicine. So now they can't give you this time. This time when they give you so long, not take them for granted. Because this is very expensive. But they take their time, take away from family, come for car, talk to family them. So they are always take with one. And if you get people that will benefit from this, they are let them continue for join. Also, we will share with YouTube channel where you can go. If you miss any session, you can go and see the other sessions that we don't do in the past. Okay. So, not to me no more than the team. Today, now Dr. Mohammed Kamara, we are a senior medical consultant, emergency medical consultant in Manchester. Now they present to me today now that they see on the screen. However, not to just me, no more than the team. So I will go through the team quick because most of them we can join. We will go most on meet them people also in the past. If we not meet them, some of them go even there at the panel. So later on, they will give a brief overview of what they did. Okay. So these are Dr. Mohammed Kamara. I'm going to present to you today. Like I say, emergency medicine consultant, A&E. Now they work. Okay. The next person is Miss Wugia to Kamara when a mental health nurse and also a health visitor. And then we meet at some point. If you ask any question, if you say he will add value, it go answer. Okay. The next person on the list is Mr. Ibrahim Sise when I qualified social worker. However, unfortunately, we're not going to deal with you today because they work. But if you jump on board at any point in time, I will make sure you know so you don't come. And if you ask anything we feel it will help with, it will help on that. Okay. The next person will get now Miss Fatima Kuruma, when I registered nutritionist in your expertise now for talk about Black people, then the food they way good for we Black people. Normally, when you read about Black people, when you read about food, healthy diets, you go see with man stuff. Not to say with man stuff not good. Yes, it's good, but for we Black people, we get certain food and we can look for it. Now, there's a way and means how we can prepare them food there, so we will get the the greater benefit out of them. So Fatima and I can talk to you, but then they have to prepare food. Which kind of food them for eat, when for eat them, how for eat them, for make sure say we will get benefits. Okay. Next person will get that Dr. Aziza Sise, when a general practitioner, instead of getting your own talk show where they call talks with Dr. Sise. Well, now they're on social media, some of them don't come across them. You can do some small clips something about 10 days. I can do a whole show on your own. Okay. Dr. Sise not there with me today. I'm not be understanding for Dr. But if you join, I will make one know. Okay. The next person will get a club mate, Mrs. Aisata Guba, a day now missed the Nabi not too long ago, now been tuning earlier. Now a mental health nurse and also now a social worker. Normally you can talk to about mental health issues and things like that. He's very experienced in other areas. So if you ask question where he says if he will add value, he will jump on board and answer. Okay. And the other person will get Namion boss, Dr. Mohammed Z. Toure. This will now all for be proud of na salon study. Now they practice na UK na I don't work in various areas and you vastly experience. If I need somebody will get experience in Apple medicine, doctor today, because you don't work, you know the constraints of waiting doctors in the face, they will also understand the issues and with patients in the face in salon. So where they do not advise, not just from a UK perspective, but they will do not advise as well based on experience where they don't get na salon. Okay. The next person we will get now Mrs. Fatmata Kamara, when I mental health nurse. I don't understand if for deal with you today, but if you join me, I will make sure you will know. And if you have joined again anyway for add value, for an ask question, you will answer. Okay. The next person we can normally get, as far as I know, enough for joining me today, now Miss Aminata Jallo, when I clinical pharmacist. Normally, I can talk to you about medicine, how for look after medicine, what kind of medicine for take in certain times, how for how for take medicine, how for look after them basically. Normally, we don't culture, if I get medicine, it work for me, I go pass on to the party, I go pass on to my family, or they will give me medicine, I don't go down as soon as I don't begin to take no more, I don't begin feel better, I stop for taking. Normally, Auntie Aminata and I can talk to we how we for treat medicine, how are the best way for take we will get the best out of medicine. I don't understand if for do today, but if you join, I will make one. Okay. The other person we can get where is still the shame. I'm not getting picture it by the friend. I promise you, not worry. Dr. Christian Bell in Germany day. Instead get a consultant in a salon where instead they help and stuff like that. If you join today, I will make one know. But normally, Dr. Bell now woman doctor. Today we can affect two man them that they specialize in what he get other areas of expertise. But if you join today, he will give a little bit more overview on within your profession. And if not get any questions for ask, if you say he go able help for giving advice, he will jump in. Okay. The other person can have Mr. Rashid Conte when I qualified biomedical scientist, even though he can shame me not to want to talk, but also a medical student. Normally, he can just be a student, but that man they well qualified, he gets experience as a salon because he don't work there. He knows some of the constraints that people in the face in the salon. Maybe present to a couple weeks ago. I'm not sure if you for those. I think you forget exams. But if you join me later, I will make sure you will know. The other person will get now Dr. Angela Hanses Amu, we're an immune boss. Instead na salon, instead train. Now in the US, they do wonders. He did with him with me. Time they say before, it will deal with you, but in office it will do to the end. But we'll try for work. No worry. We'll entice them, we'll get something small, less thing. No. If he gets on side for good, definitely you don't try it on board. If we get to the question time, when I get any question we feel say he will answer, he will more than happy for giving advice. Okay. And last but not the least, me, I'm Timu John Fuller, I'm a senior business IT consultant. Me role now so not to a medical role. I'm the helping people also for the reach uninterrupted. Me role normally I can deal with data protection, information security, cyber security, project management, and business analysis. So that are the team. If I'm them, I can hand over now to Dr. Kamara, who will take on through today. Now, for the one that we don't miss some of the shows them, or we want to go back and recap. If you go on YouTube, you type SLOGM Health, Wẹll Bɔdi Bεttεh past Gentri, and I will see all the other sessions that we done doing in the past. This phone number, unfortunately, if you reach me on WhatsApp, and I'll be able to get them. If I call, most likely, maybe something you don't know will get me. But the best way I will say, dear, when I reach me on WhatsApp, if you get any questions or suggestions, dear, when I reach me on WhatsApp. Okay. Now, for the one that they say before, if you want to ask questions at the end, there's two ways you can do. I mean, give a issue and physically, if I see you, I will come to you and take a question, or which you can do if you look at the app, at your phone where you get, if you look at the bottom now, you get 3 dots. If you click on that 3 dots there, you will see this box. When you see this box, if you click on chat, you can able to talk to me for send me message, but also you can able to use them for raise your hand. If you want to raise your hand, that is still now you press. So if you press here, it will come up like this. If not talk number you want to talk to me, press on chat. Now chat number like I go do on WhatsApp. Well, if I ask you want to ask question, you can issue an option at the end of the show there. So I can mute everybody now, so we'll allow Dr. Kamara to come to now uninterrupted. Okay, thank you very much. Dr. Kamara, when you're ready, sir.
Thank you, we will join me. And I hope so you go enjoy this session. We don't do this thing now for over 1 year. Second year, would they done so now, in fact. So, I don't know amongst the audience, who that go tell me, say, you know, one day, no, anybody or himself will not get back pain. If anybody know anybody do it, America must know. But Peking, they get them, middle age, they get them, young person, they get them, old person, of course, they get them. But I think it's important for let we talk about this back because we need to look after this back. And this back is just a suffer no more. Until one day, it tell you say, but they are fed up, and it turn out you begin feel the problem. So the problem that we get with this back, not to say that today begin, we don't begin long. So time, you know, where you be baby or where you being a toddler, maybe it's until you grow up, you know. But this topic so big that I decided to do them in two parts. So this one part today, mainly now for look at how you for help the back for protect them so you will get less pain and less problem as you grow older. Because as you grow older, now so the problem they pile on. So that make I think say when we don't do this, the next part now go look at the clinical side where we say we go look at the symptoms, we look at the signs, we look at the thing that we definitely you need for look for if you get back pain. We be saying that them for make you go to hospital like that straight away because other than that you will get problem. And of course, how then they investigate them, how then go treat them, and of course, waiting at the prognosis, how you go day later, all that thing and they like physio and all that. Then I will go talk about part two. But if not get any question relating to that, well, we'll get a specialist on board. We definitely we can answer as best we can. So I can always begin with introduction. And if you look at them, you know, we all the total load here, we all the lift 10 years, so animal. We will like them push, man will like dogs, man will like rabbit and all that. You know, we don't know, say with the Hamburg way back. So if you look at them, you can see side one person the butu for pick, you can see that's not the wrong way for do them. But you can see the correct way for do them, you know. So you get for fold, then tire, then big muscle down at the leg there, you know, so that you go for picker, and that make the maker. Again, if you carry them, if they take them go, you go see say you suppose for, you know, work out with them based on the center of gravity. But when I go see that later, you know, that's the way for do them, you know, not for bend. This person bend, and so they injure the back, so that the neck will begin go forward. And then of course, this last one, you know, before you go take three, so man can say, I remember say I go some Awujo not long ago, I buy supermarkets, this person take 3 straight away. Now I say, hey, Paddy, you back home. Now I say, nothing. Well, 2 days later, he phoned me, tell me, say, Paddy, you back home. Now I say, well, I did not tell you. But that's the thing, you know, because we're still young, we need to take notice of what we do. And this back, as I say, just they take her until one fine day he decides, say, I give up. That's when we begin to feel. So anything where you do, where you waste them and call them manual handling. Now, of course, you can lift, like how we show you that just no more. You can put down, you can push, you can pull. Then we sister and mama them until the way they push them from, you know, then baby them, you know, where they lift baby up from the ground and all that, you know, all that thing then they are part of, you know, the manual handling. So it can be thing we not get life, it can be mortal man, and then it can be animal, any of them. So in effect, if they carry any load, well, indeed, you manually handle that load. But you see, it might not be, you know, the main thing as alone. I don't know if they get this thing because we know this alone for so many years. I don't know which that the law the way they did. But for we in England, we get the lawyer, and if I'm for let we know. So until we wait in England and say, so man don't know about this. But if they know, at least then go know what they go look forward to and what they go do for protect the back. So the law they make 1992. And the law get 4 part them, you know. The first part they tell you say for avoid, you know, and you know, handling this load and do anything with them. But it's not possible for let you say you avoid and better because some work that day you just get for move things, you know, even if you know take load. But just until you go on a roof, you begin use screwdriver or anything, then they definitely it means they do something. And so they say avoid. But if you're not able to avoid, what you then get for assess. You get to find out, you know, do what they call risk assessment, you know, look at waiting that the bad thing them for this operation, and then think about waiting for try for make that thing less painful or less difficult, you know. And in doing so, you reduce, you know, you lower, you know, the risk where the person will get for injuring back. You know, like for example, instead of he pick the thing with the hand from the ground, he can actually get that trolley where he go put them there into them, and then they go help him. So if you instead of you take the 3 crate super malt, he puts them at the trolley, he save him back, like that. So then call that mechanization, where he makes that in the automatic, clearly they help you. People make, for example, where they dig, where they do maintenance at the highway. Now people we can get that way they dig the asphalt and things that, and they make too much noise. So then people they can go deaf. For avoid that, within the government do, then decide for put them thing the way they put at the 8, the whatever headphone them. So that way they get that thing there for affect them as badly. And that's another example, But of course, as time they go on, we don't try for reduce the things they change. And if then they change, you need for keep in line with these changes. So you need for the review this thing regularly, for let you make sure say where the problem then they come now, so they address it now, so they reduce the chances for recur. So this is not just for we no more. You see, then get 4 of them. The one way they put 1974 with them pull, the other one with them pull 2006, the one with them pull 1998, and the other one said same year and they took a month. So you can see say health and safety in the workplace, and they're important. They apply to all we way they work, we way they employ people them and things like that. We definitely supposed to provide safety for we employee them and for we safe way they employ people. The lifting operations and lifting equipment, again, another one for FWA, so that we'll get all their suits that we go dry way, and the money will get to the capital. And of course, the work equipment, so man no say if you work in a certain place, the employer is supposed to provide you certain things that will for help you, for protect you back. And some of them, as you can see now, they get them transfer board. We will do now then nursing home, now then hospital. So Monday, 9 that, you don't even know, but then yesterday, just literally yesterday, one guy who been the work, this man for them, old man, he pulled his shoulder, dislocated his shoulder. Now this man, they get for picker now for put him at the bed. And so this guy go Butu, go pick this man. I say, hey, buddy, take it easy. And I say, no worry. And I say, and this man, of course, now 20-something-year-old man. This morning, they phone me, tell me, say the man they complain of the back. So it just goes to show you, then sliding, sheet them, then belt them, then rotor stand them, and then see the way they turn around, just for helping them, because people, then get weight. So now they see so now, people they work with hoist them. They need to know how to use them. All the time they help for carry the weight. Some people they paralyzed, unable to move, just in a bed when I don't tell them can help for move. If they go for go get a shower or then go for go do their personal hygiene, and go use them again, then get weight. You get for look at that. If you look at the bed and the table them where they around, all the things they need for clean, for put waiting at the medicine, for put food and all that, and they self-demand something. And of course, moving this bed for good do investigation, in self-demand that. Again, trolley them. And they will do medication round, ward round, this, that, all the things then get their own effect. And where they try for a person for team up, they say I'm standing it. Of course, the wheelchair, then we all know. You go for push this person. Or how you they push them, then will determine how you back or suffer in the long term. But you will see that as we go on. And of course, the one way the person they work, like we talk about polio a few weeks back, you will see them, then they will use them crutches, then they people that will be longer stroke, they use them and then they again, if the one part weak, sometimes the other part now you the favor, and that part then go cause the back for go, and then that go cause problem. And the hip self can go the opposite side. So all the things are now can happen to we. But this thing we get now they help with and call risk assessment. So if they do a risk assessment by your employees or USAID or even the family home, you go then reduce the possibility. So you get for do them 14 years. You get for actually look at within the load where you get for carry. So the person way they look at, if the person weigh 10 kilo like baby compared to somebody who weigh 100 kilo, clearly not to the same approach, so you go for do. And then of course you get for then look at the environment with this person they assess them for see what you need. Because a man go there, sometimes you're able for worker for himself, but you for pull himself from that sit down position for come up. So if people provide something for that, sometimes then they could be easier rather than the person will not work at all. So you get for look at the environment, now make them they adapt, then host them. When person they come to hospital and they know say this person needs so. Because within the one enable the person, make it go back to human independence. You see. So again, the individual capabilities, so they get for assess that, for find out which is person able for do, which kind of task they go able do for himself or what he need support with, and of course other one that they. But that's important for Leon. So that brings me nicely to this thing, what they call we back. Now I don't know how most people know, but almost born people and feel say we get now we back. If anybody know, maybe then go for answer. I don't know. And the medics they know not for involved. We get anybody who will answer or not? Or then just mute now. Anyway, I go save the hassle. But the spine, as we call them, it get 4 parts panel. It get the neck, where they point to, so now it gets the thorax, where now they the chest, now they the ribs, and then you get the lumbar, where now the bottom back, the lower back, and you get this seat bone, where they call the sacrum. And from this sacrum, you get the other 4, 6, 7 bone that we join to, where they call the coccyx. So as you can see, 7 naya at the neck, 12 naya because each rib gets in own, and then 5 naya, and then 5, but now 1. The 5 then fuse to 1 bone, when at the sit bone, and then the other one then now. So in total, we get 33 bone them. Of them now only 24, so 9 they move. So if you look the motor mind back, when a baby, the shape of them like a letter C. But when you look at the adult in your back, it's like where you get 2 S then joined together. So man, they say na elongated S. So the neck part, they, that way they, and then the chest part, they this way. And then again, the lower back in there this way. And then of course the sit bone in this way. So 2 parts then go that way they, and 2 parts then go that way. So as I say, the neck one go forward, the chest one go backwards, the lower back lumbar region go forward, and the sacrum itself go the other way, so that you actually sit down on them, so that it no go cause you problems. So man the way down for dump and that, but the way down broken. They know exactly what I talk about. It's very painful, So here we go. As I've been the same number, 33 bone, 9 days, now this mortal man in back, but they all put together like a pipe, like a tube, and now I make you see say inside that tube there, now they the spinal cord. So where they begin now from this big hole now under the skull, and can now reach to the 2nd vertebrae of the lower back. Now they in the end, the rest of it now like where you get that horse in tail, we get then small filament, So that's how it is. So 7, 12, 5, and 5 win a 1, and then the other 3 to 5 1 they win a small one. In total 33, and then of them now only 24 they move. So as I say no more, when you put them together, then they form this tube. So this tube, now they this spinal cord, they will talk about, And then obviously, you then therefore understand what is the role of the spinal cord. Now the spinal cord, there are 3 functions there. A day for motor, that means the movement, and then a day for sensory, that means what's how you they feel, like you finger them, you foot them, you skin, and then of course a day for coordinate the reflexes them. So if somebody knock your ankle, what's the Achilles tendon there, you could see the ankle go, up and down. And of course, somebody knock outside that tendon, then the knee, you could see the knee jump. Or leg reflex, then they all because of the spinal cord. So if you injure, the spinal cord, even if not mild injury, you will get pain. You can get like then way chuk way so until you get tingling at the finger that way, like say numb, And of course, it can give rise to weakness because the muscle that SSF, they self get their own nerve supply, and if they're told they get injured, then they can cause problem, Now make you see some man, if you go inside plaster of Paris, like where you get fracture, and then that thing nowadays in that position, the way you need to move the muscle nonwhere. When you pull on now, you will find out, say if you compare it to the other leg we're not injured, it can weaker, it can less the bulk of them. So you get for build them up again, you see. So if you cut the spinal cord to bone them, the vertebral canal, you cut them, the bone them way there, you will see they consist of the body, when I this, and then you get this arch. Now this arch, and then you get the part the way the tendon, then the ligament, them and the muscle, the outside they go join, where you go make, where you move the body, you know, the spine did together, and it just to keep your body going. That's it. So the body now in they protect the cord, the spinal cord itself, you know. So if it for let people know about that, because clearly, although the muscle them within at the back, they're strong, but clearly they don't make them for then kind of movement and what they do, what they give put panel. That it's not there. We get the belly muscle there, we get the thigh muscle then that then you work for help for support this spinal cord and spinal canal. Okay. And between the bone them, then 33 we'll talk about. Each one get this thing, apart from the lower, the bottom one them way they all fuse together. So this one you get this thing and then called the disc. Between each bone you get this thing called this. And if you look at it, you go see say you get two parts. You get this part where you get the fiber, then way they around like rope, and then inside the middle you get this thing fiber like jelly, it's soft so that one day 90 like a cushion for you. We in a salon, them motoka them, they say shock absorber. We know now as a shock absorber, you know, so they absorb the shock for you so that you know get pain. But because we they grow older, this thing can get dry or we can get injured. So if you dry now, you need to do your work again. That cushion, where you been the cushion, you need to do it again. As a result, it will give you pain. And if you continue, remember, say this picture, if you see them, that's it. You see the nerve them. Now each and every bone, this thing I talk to, each and every bone, one nerve they come out. So from the left and from the right. So you get them pair one them, you know. And the two way to protect them, now this we talk about now. Look at there. Now in this. So as you grow older, this can dry, or if you get injury, this can get injured. And so this thing can come out now and can begin pinch this thing now. You know, go see and just know when we get to that. You know. So that's how people can injure them back, you see. But remember, we get the ligaments there, we get the tendon there, we get the muscle there for every on the movement there. But we need to protect the back, because if not protect the back, it will give in and definitely we will all go suffer. But I can tell you now one thing, everybody we don't turn 50, this is not the bad news. Everybody we don't turn 50 gets some amount of damage to the back. He must get some arthritis in the back. So man now wait until when they run, when they play football, when they do athletics and all that, or be involved by accident, probably the young will come sooner. A person get osteoporosis where the bone the weak. We sister, auntie, and my mother, where then done this mama corner business, this period business, then the bone themselves now so they can become weak because they need to get that monthly cycle for protect the bone. So themselves can get the same thing, you know. But if you protect the back, it will last you a long time, you know. So here we go. You see, not this now how we do way well. Then the spine this way well now. Look how the disc, the nice, beautiful blue under. They're okay, you know. But as you the damage are no more, now so it flat. And if you flat, you see it red, which symbolize, we they tell you say this one not so good, not well, you know. And as I say, you go camp on you small, then they begin pinch this nerve now. Yeah, as you can see, this one with the come on pinch them. Either come up before OBN or maybe right or left, but you go pinch the nerve. And if you pinch the nerve, you go begin feel this thing small, until one day it just cut off by you and say, now in that too. So man now that pain they can make the just for down the ground and no for grab because the back they go into spasm. So you get 4 type of force then where they with the action the way they take, and then can make this spine actually, you know, begin with a if not that you call up. They get 4 types. So one point them attention. Now if you look at them, you will see, you know, when you bend like hey, you want pick that 5 gallon per mile or 5 gallon paint or something, you bend on one side or bend near the other side. That's how this one they are picked. You see, and then here you get compression. So if you fall down from a height or can down or maybe jump, like that they do high jump and all that, all then here and that's waking up. So this is not the compression. And then you get the one with a share, which means you they sit down, position yourself at the front, then your body now they turn to the other side, either the right or left, now share because it's a twister, you know. And then if you get any kind torsional, because then they go that way, then they go that way, that's how you actually. So therefore, movements here, and then they cause this problem long term. You see. So for let we know which they cause back pain, as you can see, you can pull a muscle. By the way, up to 80-something% of the back pain then can well on their own after a few weeks. Very few will go proceed to this dangerous one way, sometimes we need surgery or sometimes we need hospital, you know. So if you pull the tendon and the muscle, then a mechanical back pain then call up, you know. So then they can well on your own, take a few painkillers, rest, and then, okay. But then you can get inflammation where the muscle them, or maybe the nerve or the tendon then get inflamed. And as a result, you can get pain from that. As I say, we don't talk about arthritis. Now you get rheumatoid arthritis, where people will get and then indifferent from osteoarthritis. Not all men get rheumatoid, but as I say, at the age of 50, everybody gets some amount of arthritis. No questions about that. Osteoporosis, we don't talk about already, but people. So Monday we get, of course, the human, they mainly can get after them past the menopause. And of course, you can get injury. I just talk about the sportsman. Sportsman themselves, when they jump, they run, they throw away discs and all that, they can get that rupture there and that can cause problem. And believe it or not, stress now will place, stress now us, picking them all, mano, wefo, all things in day can definitely cause back pain. Take it from me, and then of course we go this fibromyalgia. Well, this fibromyalgia, obviously, that the common thing that we all man they talk about. The only thing with this fibromyalgia is that it affects any pathway muscle there. I can see somebody with age 25, 30, they on so much painkillers that makes everything what they say, oh my God, which you go do now by the age to 50. All kinds of strong painkiller that person did, but still they come for more. So it's nice for let we understand waiting this thing they come from. Mainly now we self they cause that because we get poor posture. We've been just to talk about that, just a poor posture. So if you they walk behind computer, after every 1 hour, maybe grab, go stretch your legs. I mean, if you feel say you they crouch, you they bend for look at this computer, fumble them. Grab and talk to the manager for make them measure your height and your body and how it is so that you go for protect your back. Because otherwise, the body in mechanics, how would they lift, how would they put down, how would they push, how would they pull, all them things they can cause damage, as we talk already. Stressful living habits. Definitely. If you're in one place for too long, you need for learn for relax. Waka go, let the blood circulate like the leg them for 5 minutes if and come back. Of course, as you grow older, you get that thing they happen to everybody. The muscle they know as the midday and strong and they can come, they adapt. Now we know for do that, poor physical conditions. When somebody be not get a stroke or somebody be not get an injury to this thing, or people are giving get polio and all that thing, then they can definitely cause the person for in a physical condition way poor. And as a result, one part where they for use can give rise to the other part where can weaken them and then can cause problem. We don't talk about age. Again, the weight they put on that then country, when they exercise enough, and they add strain to the bone, them that the spine, and that they can cause, back pain. Well, of course, I don't talk about rheumatoid, I don't talk about osteoporosis. And then they can cause that in there. Because if you get rheumatoid in the spine, then they can cause problem. Again, osteoporosis in the spine itself can cause problem. And of course, if you get injury, then road traffic accidents, then for them na street or for them na workplace and things like that, or maybe athletics and things, or all that things, they can cause that. But I need you now to pay attention to this last statement. Yeah. You see, as I've been talking no more, the back pain or the back in problem, they begin long before the first time we begin feel the pain. And this problem will even remain with you, even where the pain go down better. So let you see no more. You understand? So as the first pain, the first time we feel that pain there, it definitely going to go small. But it's important for understand, say, the important treatment necessary because of the fact that you go for prevent anything like that for happening in the future. I hope you understand that, because this thing going to tell you, but they pay attention. Because if you say young, we may be young. I mean, they take one bag cement with me, one nana. Nowadays, they pay the price for that, because if you say they happen to you, they in denial. You're a young man, they make nyanga. And I tell you what, you pay for that. There's no questions about that. So for help you, if I'm for let we know how this thing they go on. As you can see, the body, they work like how you treat them. So if you treat them well, like how we can treat them, mama them and sister them well, obviously, they will last you long. We always need for use, that's what they call the center of gravity. Inside this ball, at the center of gravity, and that we need for use when we use this back. If you look at we then your man, young girl, then so we can just sit down in a chair, slouch, as Englishman call them, lean back. But with the grab now, you know, even they bring yourself to the forward position where you see so now, instead you just grab like that. And imagine, say, the center of gravity, the right side the ball, this one, yeah. You see, look how far this one done there, and look how this thing there. So if you not down where the grab now, not bring yourself back forward to side this ball there before you lift yourself, you they injure this back small, and you don't know until one fine day you give you say 9 that too. So you can see you need that support for stability, definitely. And you can see what we all guilty of. What they say for picking a ground, look at. You see the center of gravity, look outside there when it's supposed for there. So you don't move from. And of course, all this weight now this thing in the taker. And that is why most of the time that the lower back now the problem can be. You know? So it just goes to show you, say, do ya, where would they pick them here? Let me pick them using we leg them, we ties them, I make them big. I make them because they're strong for lifting here, plus the belly muscle. So this one is just tell you and say, depending on how much you they lift. If anybody lift anything we weigh 25 pounds, you know, which is about, let's say, maybe 12 kilo, 25 times a day, you get a 6 times more chance for let you get problem with your back. No questions about that. This is a scientific fact. So you need to protect the back. But so man now, nobody for do now make them day for help we for let we learn. Now, as you can see, they call them controversial techniques. I think the way they recommend to anybody, we way they work with them people and when they waste themselves, you know, you will see them. First one now drag lift. As you see, the person in hand under the person in shoulder, you know, for try for lifter. You now they hurt you back, you don't know. Again, the drag lift with them 2 days, again, then they drag and lift onto the top there. This is not recommended at all. This one, again, drag lift, you see, I'm in the under, sometimes you not put the brake on this wheelchair. Or if you yourself, imagine say, instead of you know, center of gravity, you now they move on from there, and from there, you see, so I don't move, we're supposed to be close to you now. You know, again, the orthodox lift way normally we can do, put your hand under the tie them, put your hand on the shoulder on a lift. But look how they walk. They walk away from the body. Look at they walk away from it. And as I say, now and again, that thing they will definitely, you know, tell you. And again, this is what we then call the shoulder lift. You know, you lift the shoulder when the Australian then get that. But again, this one I don't recommend that. Same again, you team up from the back of the patient and put your hand in through the armpit them, the shoulder them, and try for lift them. Again, you walk away from your body, you know. The one we then call like hammock, you know, you lift at the top, the other one lift at the foot for try for pull them from the wheelchair to you. They don't recommend them because one way or the other, over time, you back will go. This one, bear hugging, as you see, you know, that way they tell her do hug. If you try for lift that person, they remember. Because you wait all day for you, now you get for lift up. Obviously, then they go tell on you. And this one, people transfer them column, instead of bear hug, again, instead of not good for you. So then they did and then clear. So if you not take anything at all from this talk, remember, say, then get law them, now the workplace where they're supposed to protect you. And we need to know about this. And maybe they don't know about that as alone, but you definitely need to know that. And only when you guide yourself and protect yourself, then this thing will work for you. So remember, for reorganize, waiting that the work way they do, you know, look at the environment where they work, you know, and of course, we will employ people and we need to make sure say they know what they do. So we train them and then pass the test, and then we make sure say that they comply. They take, you know, waiting with the try for tell them for protect them back, you know. And of course, if the work really, really heavy, we need for provide them toolia, then aid their way for help them for make them easier. We mechanize, as we've been said before, you know. Of course, if they're sick, we can offer advice, we can send them to the PCOs, we can send them to occupational help, you know, for they're able for look after them and get them back and bring them back to normal, you know. Put dentina in place. So if you get a patient where you know say no for using the right part, you for don't put dentina in place so that when the people in the camp can work with them, then for don't know waiting for do for adapt for this person. And all dentina na individually person way Mr. A in yon not for be Mr. B in yon. So you go for look at Mr. A individually as a person and then deal with them as is. So now make them get these risk assessment policies and of course the care plans them. Remember, something then they close the way they wear, they suits the way they wear, and then can cause a problem. You go wear tight uniform, or maybe you go wear uniform way sleep hole, like that it can cause you because you can for dormant. If you go wear chicken heels, you know, when in actual fact you have to get flat shoes, then they self can cause you problems because if you fall down, then they can injure your back. So we need for protective stuff. All the things that they are. And of course, when you teach people them how to do this thing, you put these plans in place, you need for see how then they obey the laws, how then they comply with the laws, and then call audit for see how they're not going to come back and sue you, because if they're not they comply with that, you get right for do something about that. But they need for comply because you protect them and you protect yourself and your business or anything we do. So remember, think when you want to lift something, think and plan. As I say, for me, they always teach me, say, the end product of anything in the planning. So if you plan well, you will get a very good end product. There's no questions about that. Remember, you foot them get a very important position for they, a very, very important role for play for you able to protect you back. Then for they apart, if they actually receive something, if you actually they go forward, one foot day before the other. And remember, you don't need for the run, you need for, let's say, the waka. Again, remember the spine go for day in one line, one leg forward and the other one, they get you forward. They carry you go. And then of course, the grip. If you get grease, we will look for of them, we call it shea butter or cocoa butter. So then this thing, slip, you go for them and anything can happen. So you need to make sure the grip, they're okay. Yeah, consider the place where you come out from and which side you go. That is from A to B. In that you get heal, so until you get a few more people for a people that, or they can get like a machine, like then scooter them or something we go do rather than begin push uphill where anything can happen for them, So, and then of course the environment. If anything then at the road, you need for them pull arm, you need for them, make preparation for that. Because otherwise, when you reach you now, we don't get nowhere past you face up. So, where would they push and pull? We get for know exactly what you do. Again, consider the environment. Put the foot the outside for day, apart. Where they begin, remember, bend you need them slightly. Put your hand them at the position where they're supposed for day. So between the waist and the shoulder level, that's what them for day. Then for the higher, then for the too low, way will make you begin bend. Again, the grip, you get for be firm with all the hand them, not to the fingertip them, because you go sleep hold them for them and go cause you problem. Posture, the spine get for day with the center of gravity. No questions about that. And one thing will help you, now that test push, you go for test and see how heavy this thing, because if this thing too heavy, you go know, and if you know, then you get for get more help. It's as simple as that, and you get for team up straight, use your leg then for push forward, and the arm then not for be straight forward. This is not the problem where even where would they drive? So money and the, if anything happen where you slam that, now that they make the foot then break, and that they make the arm then break. So that's very important. Even in driving, so the arm and the leg them and the ankle then get for be slightly bent rather than full straight, because it can break them because of the force, Consider backwards. If you see say you don't know or you don't see which side they go, you have to consider backwards, definitely. So 7 principles for remember. Stop, think, and decide what you want to do. Prepare for this thing you want to do. Stabilize your base. Get a good grip. Keep the load close to your body. Then I mean the way they pull them from them, way they push them from them, obviously. That's why they go they push this. If you push them with you ties them and you hand them then at the handle them, you will definitely get benefit from that. Rather than you begin push, they go uphill and things like that. Strong thigh muscles and body muscles, then that they make them for support the back. And if when they in a group, remember when I get forget a leader, that leader then I get for give clear commands as to how they go. Because if they go before, then the other end they go behind. No clarity, no day, when like that too, when I go end up with problems. So I go stop so far, I don't talk boku. So thank you very much for listening to me, and I go able to accommodate questions as best I can. Thank you so much.
Thank you very much, Uncle Doc. Okay. Thank you very much, Mifambulem. Now the floor don't open as soon as you no more. But they can't unmute. They can't ask everybody for unmute. Obviously, most of we grew up in a salon. However, some of we not do. For the one who not grow up, they will not get a experience there. Yeah, they come, Mr. Charles Hennessy. And for who will not get an experience there, I don't know if I will say fortunate or unfortunate. But some of who we grew up, they we will sell, we will toot water. There's a lot of things in the muscle boy picking where you don't pass the age of 11, 12. we feel so macho, we feel so now strong person, man. We'll therefore be very careful for look after our back. I will go to Dr. Mr. Charles Senesi. Like wait again for say. Mr. Senesi, unmute yourself, please.
Him.
Yes, sir.
Let me introduce Dr. Senesi.
Okay.
Yes, now we are person, himself na salon in study and all, and a very important person for we. In fact, now I've been the talk to say we go try and see whether I go present for WIP and this hepatitis where they blow in minds away in Africa, So welcome, sir.
Yes,
we're really grateful
very
for
much.
your attendance. Thank you so much.
Yeah, it's great. Actually, I want for clap for you now. Me, hand. Well, it's been very inspiring. I followed the presentation, and indeed, low back pain or back pain in general are quite an important issue, especially for people of clerical job and how they do things. So I think it was well laid out, and I very much appreciate the way you present them, and we appreciate everybody who joined this forum this evening. I'm very happy to be here, and then I hope I've come to stay and to contribute as much as I can, and I love a lot of these sorts of things. I had a huge diaspora all over the world in every continent, and so we hope we were able to come together. And I like the way the medium is in KRIO, we say go for land. I'm based in Switzerland, so not every day I get the opportunity for the luxury for speaking the language where I like best. But I think it's been good, it's been excellent, and I hope we continue this sort of interaction. I very much support this. Thank you very much, and then let the discussion continue.
Thank you so much, Doc.
Thank you very much, sir.
Okay.
Dr. Ture, if you're ready for give your own contribution, that's fine. If you're not ready, then I'm going to talk while they get ready. Like what they say before, they tell this alone. I remember quite vividly. By the age of 12, I did total one bag rest. That was nothing. Now do I get back pain sometimes? Yes, I do. Now, whether I would say 100% a day plus becoming a person will be wild. But at that age, the one thing I'm away me will get for encourage Kamara them and even adults them way back home. Even if Pekin say is strong enough for do them kind of thing and they low they try for discourage them, learn how they do them because later on in life, probably in the way they go face. Me allow me a lesson where one time I decided say me own manpower don't reach for go to cement. Yeah. I don't ever forget the lesson what I learned. But something like that, for example, for me easily, and me, me adulthood, so for me, I would say, I know say yes, Kamara and they way, not only way the picking cell, they give feed the family, but all they be careful as to the amount of load where would they put in their intro and kerosene and whatever like that. There's a lot of things that they would do at all. People are going to say, yeah, you say that because you say you did, but their life and then our life, then we miss say go through. Now, if I get the opportunity for that to happen, I will. But what are they saying no more? Allow the Kamara and with the people with the men them picking, allow they think about that picking in future as well. You want he just spend money for you now, or you want it on big man or big woman, wait tomorrow, you will look after you in the old age. That decision that they get made at the early stage. And for we the big one them as well, if today I don't see Bokutem, not to just salona, the tool the day people and they bypass the tool and they look and say, for Tita they go get that hoist ready, or Tita they go get that pump truck ready, a pump them up, I can able ace the box. There's a reason why make them put on the use them. Save you back. There's a lot, most of we more than I get a bad bit, they are the working IT, and they sit down all day. And then they get a bad bit for go so. Because after a while, they feel comfortable for them that way they for go, but they pull you back. And not take anything for let you spend that 5, that 2-3 minutes, grab, and then a coffee, go make them. Then they help you for let you gain some blood flow on your back. And you posture as well as to how they sit down. Also, we get ways them where they can do our place where they assess you. To me, for example, the first time we go to a place, I look and say useless. Why then will give somebody a special job just for can't sit down for tell me how for sit down. But as time goes on, you begin to see the benefits. So, Dr. Ture, when you ready, sir? You not ready?
Well, really, I think so. We can left on for the second phase, where we will talk about the management and the other things that would happen. Except people that need anything for talk on this.
Well, I don't mind for let you talk to people, and because one thing where people must want to understand, most of the people in back home, once they don't pass a certain age, that's what they call exercise. And things when they say exercise, now for just come out, work trainers go on. Some Monday back as well, when they're ready for go on, and they do any stretch. Sometimes they then small stretch, then they way certain exercise the way they do, where they help with NTR. Because so then okay, you don't make the mistake already, you don't get the back pain. But now, how for manager? Not all the time medication. Sometimes they simple exercise the day where people can do, where can able help. Example.
So yes.
Yeah, go on, Dr. Toge. So I go let you give people a little bit a taster of what some of the things that where they can able do, where go able to help them with them back. Please, sir.
Yeah, so basically, back pain, as Dr. Kamara say, and a very common problem. After the age of 50, back muscle all they become stiff and everything. Not unlike Pekin, where it's very malleable, like Obafak. Pekin back and whole body like Obafak. They will bend in any way. But when you don't the age, the muscle and the tendons that we join to that bone, then bone that way Dr. Kamara they talk about. Sometimes they can tend to be stiff, and sometimes then they go into spasm, and that pain then can make most people and then they go see doctor. And most people are like in the UK, when they get back pain, the next thing they think of, they scan them back. Not so every back really needs scanning, but conditions then when we go to the next phase of discussion, we say the condition where they get where they make you go see doctor, where a need for letting go scan you back. But largely, most of the time are exercises that you need for help you back. So I'll just share a few slides them where people then go know certain exercises them what they can do. We basically go help. For instance, I don't know if I can see this.
Yeah.
Right. So basically, the key points that we need for taking into consideration. You get for the drink, hydrate yourself when you exercise. Remember, you perspire, you use your heart, the beat fast, you all part by body they walk where they do that small exercise for you see and small, but most parts of your body and your organs and they walk. And especially like Salome very warm, so you get for the really drink boku water, 2 or 3 liters at least, for keep yourself hydrated. Then you make sure you get a very good space within you, so that you know go for door, go to exercise you for door, you enjoy yourself, and do it gradually and slowly. Not start for exercise today. You feel say if you can turn Mike Tyson the next day. You see, so you get for doing slowly as your body basically allow you. So few exercises that we can do. I know most people can talk about they don't have grown or they don't, different one in day. For instance, like this one, they really try for train your back and your muscle. That belly area and I did the lumbar spine there. So if you lay down flat like how this person lay down so. You put your hand in at your side, you turn your face one side, you tense your muscle, your belly muscle. You do it for like, for like 5, you count 5, okay, 5 seconds. Then you relax. Then you do it back. You can increase that to up to 10 seconds. You do that there all the time. It sounds simple, but it will help you in a long way. It will help you back. The other exercise now, like what is what they call pelvic tilt exercise. You lay down like this woman, lay down at your back, your hands and then at your side, then you bend your knee like this. Then this muscle, your belly muscle, now they do most of the work. They stiffen and tighten them, and hold them for like 5 seconds, or you count 5, and you repeat that day regularly. You can do it most of the time. It'll help again your back, because when you lay down just by lying flat on the floor, it'll help your back for straight them bone there, na boku bone then join na your spine. It'll help them forget at least that and posture they're supposed to forget, and it help for relax the muscles them and the tendon that we join and hold them bone then there. The other one way very good, now the knee rolling. you did do like how that first person do, like how this person has laid on. That's so you did laid on. But the difference is that this you they take you and you put her under your aid, or just by aid, so that you're able to stabilize your shoulder. You see, you stabilize your shoulder now. Then you move you all knees then at one side. When they move your knees and at one side, they make sure say this your shoulder, they upright. You need to move at all. Now only way they move now your knees there, and you count 10. Then you go back now this position, and after that you go now the other side. If you do the left side, then the other side go the right. You do that, they help for manipulate your spine muscles and tendon them. It manipulates and gradually. So most of the pain, it's painful at the initial stage, but let me say when you do it start slowly and increase as time go. As you continue for doing, not to exercise, you do 1 day, 2 day, continually, you see it help you back. Then the other one, I like this knee and chest exercise we can do. Like you lay down like how that first person be laid on. Okay, I can always bring on to this one. Then you hold your knee, you bring on like you bring on towards your chest as far as you could. You know me say get for knee touch your chest, but you can bring as far as you could. Then you wait that position there. You know, you hold on there for like 5 seconds. You know, and then you relax. Then you do not the other. If you do not the right, after some time, after you done the 5 seconds, you do not the left. Okay. The other one are these people who then can get, you know, like behind the bum down to the leg, then they get pain there. It can do for stretch, then call them muscle and the hamstring muscles there. It take the center of gravity, like how Dr. Kamara they say, you try to take that position, then you put your body there straight. Then you take a small stool, you put your foot, then what all you can do, this other foot where your body deeper, now you they bend slightly for stretch this hamstring muscle here. Now, somebody will get condition called sciatica, and then most people in the UK, as you get back pain and sciatica, the things they get. And a pain in the back where they lead to the pain they radiate or they come down to your leg. Waiting Dr. Kwame they talk, then side them between the bone them where something like lip they come out through the cushion in between. It press the spinal cord and or it press the nerve. It cause the nerve pain they go down because from the back, now then you get the nerve where they supply right down to your foot. And that same nerve they supply your bum area, and then they supply your bladder and your bowel as well. So now I make most of the time people encounter back pain, you go see doctor. A few questions then they ask you if you're able to control your bowel or bladder. If somebody you get back pain, then you get accident. You able to control your wee. You get accidents before you go, or before you have a poo, you get accident outside. That's a serious thing, and the way you. Now then one of the conditions will need scan immediately, but we'll talk about them later. So if you get an acute condition and day, you maybe no need for do this form of exercise. Okay, you can do them force exercise. That I say like this one, knee rolling and all the other pelvic tilt exercise. You can do them, or you can talk to a physio. If you know fancy for lidom, you can do this. You can just stand up again as we talk. You take the center of gravity. You just put your hand at the wall, one hand at the wall, and then you bend. The work more to be done by this right foot here. You bend them and make sure say the knee in line with his left foot. If some people go do, you know, go and bend your foot properly, the foot go there front here, then they not go make you do the exercise properly. So you can do you hold for 10 seconds, okay, then you stop. You give a break, you do the other foot. So all the exercises and they help you for strengthening your back. Now, this is not the back stabilizing exercise where you go on your knees like this woman. You put both of your knees then down and your foot then down. Your knees and your hands then down. Then like you take your right hand, you stretch her out. Just your right hand, I stretch out, you know, for like 10 seconds. Now, this fine, but the best way as you continue for doing now, when you do your foot 2 foot, then you lift your left foot or your right foot. You keep your right foot up. This is why they keep the whole spine in a straight line, you know, and they help the muscles them and all lengthen the way all the thing for let you bone them for strengthening them. Okay, so this now one of the very good exercises them. If you're able, there are so many of them. If you're able, any one of them where you're able, you can start with them. So I think that are the main exercises then and there. There are quite a lot of them. If there are websites to call Arthritis UK where it show you not just the back, your neck, your shoulder, your knee, all sort of exercises then they, and their exercises and it's on Monday, then no one do there, then they rely on medication or feel say they will go do operation for them at their back. I'm telling you, if you witness a back operation, you maybe not go on for do next time. So and the outcome of one good, but not very fantastic, I'm telling you. You know, so then exercise, if you even when most people in the community, they want to let them scan them, they want to learn the operation, they hope they okay neurosurgery, it with all the surgery until the last stage. But the exercises there with the physiotherapy, they go a long way for help you. So I mean, I can stop. So I say when we talk the next stage, we will get so many things we can talk about. But I will stop so for now.
That is fantastic. Thank you very much, Dr. Tue. I can't tell no more. You not tell no more, but na bone doctor as well. So you know what they talk about. When I don't see what they talk about simple exercise. See what they call simple. As simple as it be, the benefit, you know, is a lot. I play football, so I get an idea of what they talk about. And somebody tell me the way they say so. When una come off the show, una tell no more. I'll come back and give a testimony as to how you feel. Now, not to say that anything really strain as soon as see not anything really strain. Yeah, Dr. Ansels, I conscious say you might get for left with soon. So, yes, ma'am. Dr. Angela?
Yes, doctor. Sorry, no, I mean just one buttress within Dr. Kamara and Dr. Tue. Thank you very much, sir. I get an aunt where they don't diagnose an salon with a condition where they refer him to India for go do surgery, but he gets a son and he get back pain, severe back pain. He get a son where they Kenya, we say make he go spend some time. Then he gets a second opinion. Guess what? They exercise there with Dr. Tue talk about so. These were all what she was doing. Today as I did talk, he no need non-surgery and they do fine. And you know they joke with their exercise there. Every blessed day they do them. So I just want like, you know, just say that's something where they work. I don't see somebody way very dear to my heart when it way they work for. Okay. So
thank you very much.
Thank you and over.
So the testimony. People and they way some of who say putting at the audience at the moment, I believe some of who don't go through the entire. And an advice to me, fellow young man, them was done as if we're younger past me. We would go to gym, we would go for a 6-pack, 8-pack. Oh yeah, be careful. I know how they talk. So then I can go gym. I see someone they say they go spend 2-3 hours at gym. If you know to a professional athlete, you don't need for go spend 3 hours at gym. 1 hour is more than enough. Never begin take weight as well. You read Dr. Kamara, see weight you don't take anything over. Is it 25 kilos? Basically, you begin overdo them. To be honest, the simple exercise where you need for tone up your body and build up your muscle, unless you're a bodybuilder, you don't need to lift 100 kilos and whatever. Have I done it? Yes, I have. Did it pay off? No. The consequence not good. So now me advise that don't get me wrong, I work out, I do everything I want to do. But that's because of I continuously do other things enough for make sure say I keep the other problem the way I be done fend from the time I be younger, I keep them at bay. Yes, Mr. Usman Koma. Mr. Usman Koma? Okay, Auntie Edna. Auntie Edna.
I will show you calmly.
Auntie Edna, go ahead. Yeah. Mr. Usman Koma later.
Thank you so much. Dr. Kamara and Dr. Tue, I want to thank God for giving us people like you. I wish we had many, many more people like you all over, in all corners, because this gives us hope. Thank you so much for what you're doing. Thank you so much for today's presentation. As you said, Dr. Kamara, there's not one person you know or I know that has not complained of backache in their life. So many people complain of backache due to one reason or the other. I want to say for sure that what we need is, having gone through what Mr. Toure, our rapporteur. Are you Mr. Toure? What you said about young men and carrying heavy loads in our hometowns, it's true. But as we grow up, we need to be enlightened about how to protect ourselves, like Dr. Kamara has highlighted. The positioning when we lift things, our movement, how we sit, how we stand. If you look at us all around, we all slump, even on our chairs, even when we walk. You see, some people, when they're walking, we just drag our feet, as if there's no care in the world. We need to adopt some good posture to keep that spine in the position it ought to be. Well, it's never too late. It might be too late, but I just wish that when we start having back pain, we would go to the right people who would advise us on simple remedies like the positioning, how to lift things. I have learned, I don't know whether it's because I've been a nurse, I have learned not to bend. It's easier to bend your knees than the whole back. But a lot of people don't know, they just, especially men, they just pick up heavy things, thinking I can do it, I can do it, macho style. But I want to thank you because this is so enlightening and this is so good for us. I wish we could all have it before now so that we wouldn't get to the state we are in now. But even for the younger ones who might be having back pain and they listen to these lectures, I'm sure their future life would be better, brighter, painless. Thank you so much. And when we talk about the remedy, as for the exercises, I am going to do some tonight because I suffer from back pain. I'm going to do some tonight. I was watching very carefully. I like lying on the floor. I like actually, when I do my little exercises, I like lying on my back on the floor. I'm going to try Dr. Toure's ones. I thank you so much, very, very much from the bottom of my heart. And I look forward to the next sessions on back pain. Thank you.
Fantastic.
Fantastic. We don't get one convert. Like way Auntie Edna Bεttεh no more Willie young man that they can't Victoria Mr. Usman Kuma. Like way Auntie Edna Bεttεh we young man them. Game the day where we can play. Where we feel safe within our TV. Oh yeah, pipe down. Love addictive. Yes, I see Mrs. Goba they smile. Una boku they smile no time to talk about. Listen, not to you first, and not to you get for be the last. Look after you back. Not a competition. Yes, Mr. Mr. Osman Kuma. I will touch on that name before done back. Mr. Kuma. Mr. Osman Kuma.
But I good evening once more. I'm really sorry for coming late. I've been given 1 or 2 assignments there for complete. So I really appreciate Dr. Toure's lecture. I remember the child we did secondary school, they take biology classes, some of the materials are be available. So I really appreciate that, and I hope they will implement them on our country because, some people suffer of back pains. So man get so many issues concerning bones, back pain, other things, So to the public in this country, Sierra Leone, and establish this particular thing so that people will be able to understand, how to take care of all the things they have to. For example, me and a victim of this particular bone problem because I get a waist bone problem from the war where everybody only they beat me mercilessly, and right as I talk to you now, so every month, every 1 to 3 months, I get something like pain where they come with bone, you know. So I feel I'm so can't wait. I don't give people grab if it's has to done. So I don't know really like maybe advice what I can do about that.
Okay, I go hand you over to Dr. Ture. Whose advice you could give Mr. Usman Kurumasa?
Well, I'm not gonna ask age, but if you don't do that long time, the exercises then what we talk about, so you can do them. The other things then they can watch for again. You know, I would say talk to your doctor, because other things then they can cause pain in the back, especially if you cough or sneeze or so you feel pain now your back. If not the UK a day, you don't get that long term, it can make them go do. Because of the duration, a possibility if they can do an MRI scan for see if you didn't get any collapse on the vertebrae, then the way doctor be the talk about, or maybe sometimes arthritis can develop there and all that things, and they let them just know, say because of the duration, it maybe need for do anything in it. But if you're not the UK, then it just a salon. I mean, for spend that kind of money they for do MRI scan, it probably can just do the exercises and go help as well. Whenever you think say able control your bladder, your bowel, and the back pain, they go down your leg, put your 2 legs there, your 2 foot there, you're not able for move them, then a worrying sign. And the other worrying sign again is some people then can get circulation problem at the leg, where you work out for some time, you need for sedum before you continue. And call and claudication is similar to one condition and called spinal stenosis, when that area also have the top one that can happen. So again, it depends. Like now, it may be just the exercises that they go help. You may not need for do anything.
Yeah,
I hope say that helps.
Thank you very much, Dr. Ture. We get 4 people up. Auntie Victoria. Auntie Victoria.
Ask her for unmute.
You hear me now?
Yes, ma'am.
Okay, no, I say I did try for echo waiting and Edna say, but say thank you to the 2 presenters, but mostly to Dr. Ture. You know, the exercise, the way you don't show the pelvic tilt and the knee roll, I can do at the odd time, only when I went to fit into a dress. But I don't be nothing that way good for me back. So from now on, I did take that on board for doing regularly. So just to say thank you to the 2 presenters.
You're welcome.
Brilliant.
You're welcome. It's good.
Thank you very much, Auntie Victoria. Hey, me plaba mate. So you can't give him the advice for the man? Okay, go ahead.
Lord have mercy. So, anyways, if I'm I just want to add to waiting Dr. Kamara and Dr. Ture said. Thank you guys very much. Dr. Ture, those exercises are brilliant. I do them sometimes when I've got time. But anyways,
why do we talk to me give time?
Yes.
You see? They know you.
Anyway, yeah, as I been telling Dr. Kamara the other day, because me as somebody where they teach manual handling, when they come to back problem, now small advice no matter add back. Now when get back we get where you go. So the simple way, like where Dr. Ture and Dr. Kamara don't say, for let women we back, especially we women them. Maybe so then a kitchen, we get picking them and all them things and they. And for let women we back, look who watch the way toddler they pick something at ground. If toddler drop something at ground, you know they bend the back for taker. What do they do? If they go down with 2 foot there, they go down with his step and take that thing at ground and come up. Instead of you stretching, for stretch, go forward, for take something, no, not one. Go down like saying butu, you pick that in and come up, it is safe you back. Then the other thing again, because as Miss Edna be done say, Miss F na nurse, we all na nurse, and we get boku carers that are this forum. When you work as a nurse or as a carer or anybody they take care of somebody, if you're in a hospital, The regulatory, they say you get for use the hoist, and they make a mandatory, so you get for use them things, and the way to make what they use and for protect we back. In the past, they don't sue so many hospitals, so many care homes where they broke them back they get problem. For like all that suing, they stop. Now they make a mandatory for use the hoist. You use the slide sheets, as Dr. Kamara don't say, all waiting Dr. Kamara mention, if we follow that procedure there, and if he say any of we will end up forget bad problem. Now, not get me wrong, we go get her as we grow old, because waiting do, all the NTNB don't come into place until after 2001 for begin use all the equipments and there. But then period and the way we say nobody use them, the one they be done the work as nurses, stay out and get back problem, they would never forget out of. And they just they manage. So there, my advice is, if you work in a hospital or you work in a care home, or you look after anybody, even if picking in a house, where they go down to take something, make sure say you get close to the individual and take them. If you want to go down for stretch or do anything, put the right foot forward, the left foot there backward, go down, and the same way you come up, you will help yourself. And as Dr. Kamara, Dr. Toure don't show you all the exercise, and I believe so if we follow all the things, and the problem they don't solve. You don't need doctor, you don't need medicine. You
really?
Follow the instruction. If you follow the instruction and because policies, procedures. No, seriously, if you follow them policies and procedures and do the right thing and posture yourself in the right way, you can protect yourself. And I'm taking that spot today. And I can always say, well, Bɔdi, we only say better past Gentri.
Thank you.
Thank you very much. See, many make plaba no more, but na sense man. It gets sense.
Another answer.
I'll go to Brian, please.
Hello, I'd like
Yes,
to put a question to Mr. Kamara, what happened to me a few years ago.
Yeah. Hello, Anne.
Yes, ma.
Hello, Mr. Kamara.
How are you, sweetie? All right.
Yeah.
Thank you for joining us.
Yeah. We're at Scarborough.
Oh, look at that. See, I'm envying you now.
I know. Mr. Kamara,
yes,
many years ago, I used to work on the stroke unit.
Right.
And we used to do therapeutical angling. And we're all trained up and everything.
Yeah.
And this particular day, I did all the safety things with the patient, and the patient dropped.
Oh dear.
Just down.
Oh dear.
And injured me back.
Yeah.
And it was quite painful. But also the exercises that Dr. Toure, I do them because I got them off the physio.
Brilliant. Thank you. Thank you so much for sharing that experience with us. As I said, it's just a testimony for us all to learn, as it were.
Yeah.
You know.
But thank you to Dr. Kamara and Dr. Toure. It's been brilliant.
Ladies and gentlemen, this is Mrs. Binks and Mr. Binks. You know, they've been with us and they've supported us, you know, throughout this journey. And I'm really eternally grateful to them for the
it's
support,
brilliant, and we're proud. And we're proud to be part of the group.
We are prouder to have you. You know, but it goes to show that, you know, we want to play the hero or the heroine and things like that, and people drop and you want to, you know, jump. I remember, as I say, just a couple of days ago, outside the A&E, somebody was there fitting, and it turned out, you know, this person was just, they call them pseudo seizures, you know, pretending to seize, but they weren't seizing, you know. And as it is, they rushed because you want to make sure this one is not actually injuring themselves.
Yeah.
But all you can see was the young guys just, you know, just sort of, you know, just taking up and just taking off there. I think, hang on, mate. If you actually considered your back, and the guy didn't look at me or say anything, I mean, come on, let's go in. Put them on the trolley, and the second day after that, he said, oh, where is this guy? They said, oh, he's not come back. He's back. He pulled his back. So it goes to show you, it is there, and we all have to comply with these laws. Unfortunately, some of us weren't working at the time, or when we were working, these laws were not in, these protocols and these regulations, but they're there to protect us. And if you don't comply with them, There's no comebacks. There's no way for you to turn. So, but if it's something that they're lacking in, then obviously you can then sue successfully.
Yeah.
But all I can say is, even if you paid out, they give it, you know, how many thousands or whatever, they still cannot commensurate with the pain and the disability that you develop with the poor back. So that's why it's important to just, you know, observe what is required of you. You know, look after number one. That's all I can say to you, because otherwise, as it's been said already, you get one back, and there's no spare one in the box. So look after it, cherish it, and you definitely would enjoy that.
And the thing is, Mr. Kamara, you don't expect, you do all the safety things.
Yeah.
And then the patient drops.
Yeah, I know. That's the danger of it. That's the difficulty, because you want to reach and protect that, because you think, oh, there is a incident form, you know, you've got to put incident form and things and all that. But at the end of the day, the incident form would be dealt with, you know, responded to and all that. But the back, well,
that's it.
You know what I'm saying?
It was quite painful. I could hardly move with it.
Yeah, oh yeah, it's really disabling, really disabling. There's no questions about
it. It was.
You know?
Yeah. But
well, thank you so much for that input.
That with you.
Thank you.
Can I just say, Kamara, it's a privilege to have to work with you and to be.
I'm so grateful and honoured.
Yeah, well, as you know, I've been working at the hospital with you for over 5 years, pushing patients of numerous different sizes and different methods, chairs, beds, such thing.
Yeah.
I once got told off when I first started there that I hadn't raised a bed to the correct level.
That's right.
Yeah. Taking that into consideration, pushing all those patients, my back still doesn't give me any trouble, and that's just by complying with, as you have said,
exactly,
looking at the size of the patient, looking at the method of transport, and assessing my route and making sure it's correct. So thank you so much for highlighting.
Welcome. Ladies and gentlemen, Mr. Binks is over 6 foot, so he has to look after his back, and you can see he's doing that tremendously well. So thank you for that.
No problem, Doc. Thank you very much.
Thank you very much.
Mr. Kamara.
Thank you so much, Ed.
Thank you very much. You see me fumble them? You want to wait till like a shots now? You see? Or they provoke me now. Why? Or they pick on me. Yes.
Dr. Kamara, there is a law again in manual handling, isn't it? Where I can be say, if where patients they go for them.
Yeah.
If you know it's not safe for you, they can always left the medicine for them.
Absolutely.
Indeed.
Absolutely.
Indeed.
Yeah, because the other thing anyway be say somebody, one of the staff them, the residents they for them, you go help the person. I ask, I say you serious. Now starting up the watch and say serious. It's no like that's okay when I go.
It's a natural reflex because you care for people. You want to protect them. That's it.
Yes.
Unfortunately, in doing so, we're putting ourselves at risk and doing things that we shouldn't be doing. It's as simple as that. You know, we all are, complicit. We all are guilty of that. You see somebody going now, you want to just dive in and do something. But unfortunately, in doing so, we forget ourselves as well, But thank you for the input. Yeah. Mommy,
I'll go. We get 2 hands up. We'll stop her within 2 and then we'll close for today. Sifatu. Or is it? Oh, Mommy Sise.
She was on, yeah. Yayo's kitchen was on, yeah.
Good evening.
Yes, ma'am.
Yeah, mama.
Good evening. Now, thank you for this question because right now, I'm a sufferer.
Oh dear. Oh dear.
What's this? I'm a sufferer for back pain.
Oh dear.
And it don't lead me now to arthritis.
Oh God.
Wow. Yeah, during winter, I'm not able to do nothing. If the place cold, that's trouble for me.
Oh, no, my sister, they talk.
Yeah,
the talks, I know this voice,
Nami, this one, the begin modern began and the small one weekend, I be the ones and jump in a back room. So when you see a butu by the say what they grab is made, that this back pain begin for me. Now so ambulance can't take me then go to me now hospital. I said they reach there then give me morphine like how they talk about that so the pain don't go. Yeah.
Yeah.
But it's like, yeah, I don't take my medication now for a very long time.
Indeed.
Well, they take them like 3 times a day.
Yeah.
Yeah. So what it makes if I can't continue back for taking back like 2 times a day, why we can't get in 3 accidents a day?
Yeah.
Oh
God.
Yeah. Yeah.
Yeah.
But
you see, I
what
don't know.
I small.
Yeah.
Is it epidural they give back pain?
Sorry?
Epidural.
Oh yes, definitely.
Yeah.
Definitely.
Yeah.
That's the short answer that if you want me for going to the long one, I can go into that. But definitely it can cause back pain. Yeah, there's no question about that. Yeah. Then the short answer that definitely.
Yeah.
Yeah.
Because a few years back now, they go give me, I don't know what's it for back. They tried for me injection and be back now, yeah.
Yeah,
but it went for a few months.
Yeah, steroid injection, yeah. Then
Yeah, just for a few months now, what is it? But now that's like anything why they do hard work. As soon as I begin feeling me back, I left.
That's good.
Yeah, no, definitely. That's the best thing you can do. That's it.
Because it's like then there's why kids are back for the begging. Oh my God, why I can't home? That's trouble for me.
Yeah. Yeah, it is. That's the thing about it, So now for protect the back as best you can, really.
Yeah.
As I say,
that exercise, the exercises that the old Dr. Ture showed today, they're not been showing me the one because they show me some exercise.
Well, you see, now you know time for camp, you see.
I said this. I set me clock today. I said this are for this.
Oh no, no worry. I tell you some more. I can't show you how for exercise.
This. Wait, I said enough for sorry. This Malia. Yeah, I do, man.
Okay, my family. Thank you.
I'm fine.
Unfortunately, we don't pass. We don't reach the 1.5 hours we can normally come on for. The only question I want to ask from a quick Uncle Doc, this is something I don't hear 3 occasions now, and I'm sure not to 3 people in the number that people want no personally. Somebody way old where they can give the injection in at the back, what that the name? The steroids at the back for pain. Waiting can normally be the after effect. How effective it be?
Well, it's funny that, I mean, Doc go bear me witness because as it is, the first one who they can ever give, now the most effective pandem.
Not for belly, not for where the belly side. I talk about where they get shooting pain at the back where they go towards the hip. And
that's it. And you talk about sciatica and things like that. Yeah. That's exactly where they respond to. As I say, when they give the injection, because normally they can use maybe ultrasound or maybe, people are really know inside the anatomy and everything, inside the bone and joint and this, that. They inject her nicely there. They give some pain relief. The problem is, any sideways steroid go where tendon day near day, it can harden that thing there and it can cause pain. So it's not there without risk. Although it give you respite from the pain, but again it can cause other things. You know what I mean? So there is always that side effect, but you have to look at the risks versus the benefits. Yeah. If the pain's so bad that you need something that will help you, and then not say go need surgery, then at least that one thing that they could do. Then get thing they call the TENS machine, like the electric current where they go through the skin, where you could put like a belt where they wear, and then the current they go into the body, that is the app. The key thing here is clear. The body and the brain, then they recognize the pain new up to 3 months. So if you take medication, you have to make sure say at that 3 months period, this pain don't get controlled and don't come down. The moment you go beyond past that 3 months, the brain now and the body, they at loggerheads. The brain, they say, this is new. The body, they say, this is old, or the other way around. And that causes the problem. Now, make you see some man, where you don't begin their own medication now, like that. You know what I mean? Now, chronic regional pain syndrome, that you will pray God for, let nobody get. Because believe you me, remedy not for that. You will just try and, alleviate it no more. But coming back to the injection, when they give you at the first time, it can buy you time off, give you a bit of respite from the pain until up to 6 months. After that, any subsequent injection are not going to be equal as effective or, as good as the first one. So now that make it important for waiting for do or waiting not for do. But as I say, most of the time, 83% of the pain them go settle on their own. Right posture, the weight, and no waiting for do, bend the hips and all that, it does help. And of course, to top that, the exercises, definitely they help you before they go put you under surgery or go injection. So as I say, for me, prevention better than cure, because you don't know exactly how this cure will take place.
Okay. Just a follow-on question on that, Dr. Tsuge. So after we don't give this person the injection, the reason why they ask this, 2 or 2 people and we linked to this issue, they on the call, most likely they don't want to ask, because you don't directly relate to them, but relate to somebody very close to them. The question I want to ask is, if when they get the injection, 6 months time, it can make them better. So after 6 months, if that pain they return, waiting will most likely happen, or is there anything the person can able to do during this 6 months period between when they get them to when most likely it might return back? Is there anything we they can do for make sure they try for stave, that issue there in the future?
Yeah, I mean, the first day for try for protecting back.
Exactly.
Well, yeah, we don't reach that stage now where
so if you don't protect
protection don't feel.
Yeah, you don't protect him back. The condition they're not an ongoing condition. So just they buy time, and the injection they no get less than 3 months though. After some time, you get for give time when they not just the back, then they get for the knee as well, because the steroid na anti-inflammatory, na analgesic as well. Although you get other effects with the toxin, thinking in a swelling around the the joint of the back. Basically, they help for reducing swelling in there. So in addition to that, again, for they do the exercises them. If say arthritis, when an ongoing problem, again for no say, or whatever medication they get, it just take the edge of the pain. Because some people feel say if it don't get back pain, they don't go get injection, don't do exercises, 1 10, 2 10, then they for stop everything. So they take the medicine and they double the dose of the medicine just to continue to take them because it want for pain-free. The reality is you hardly ever will be totally pain-free. That's just the hard fact, but at least they take the edge of the pain for let you able for do what you able for do. And then you continue for protect yourself. After 3 months, 4 months, then you repeat the injection. But then they try not for doing 2 10 3 10 or so in a year, and then if any complication come from that injection there, and you get the symptoms that you don't get, you get for monitor them and say if any new one come or a different in the character, that it can be saying that something else don't come with different from what you get. So you get for go again, always talk to your doctor, they assess that and see if you need at that stage you need scan or anything else. And then if they don't do scan, it's say nothing or day, then you just get for continue with the exercise and the painkiller and protect yourself.
Thank you very much, Doc. So
the other thing
one out of time, so I can't go around the
sorry, Tim. Important for people to notice as well.
So Cecile, do you want to say anything last word for people about they are making short a big one out of time?
Well, the only thing what I want to say as well is now this way with the education what they get, where Dr. Kamara and don't give people and so, because sometimes when you understand the condition, you'll be able to deal with them. If we all know for say that ligament, then things the way they between the spine, now in they come out, now in they pull, that one day. So if the doctor don't educate you, they don't educate you, I think they're able for control where the pain come. Instead of go take medicine, say I need for take the medicine. Yes, you can for take the medicine, but for say now this is not the reason we make me back day like I did so. Now when we not understand, then ligaments, then vein, then arteries, then whatever it is, where join, now then they pull, now then they crush, now then they make when they don't done, then bone, then they rub together, now they cause the pain. If you know that one day, you know how to deal with that pain day, you know how for you to accept them. I think outside the problem there is the way people feel for say there is remedy out there where you not get the education, you not get the understanding, now because most of the people in collect and go back again and again and again. But if you're able to deal with them, understand, I think you're able for, like in anything, now education, if you know what it is, it make it easier for you, it make it much, much better for you, and you go able for control that pain there and do other things them will go make you able for live your life as much as possible.
Yeah, I agree. So sorry for interrupting. I agree with Ruge. Just one thing I want to mention with people. Now, the exercises are so to talk them very, very important. Now, before you do exercise, sometimes the pain. Someone go say, "I get the pain. I'll go able for do exercise." Now, if they give you pain medication, you take the pain medication maybe 10 or 15 minutes before you want to do the exercise. That don't calm down, take the edge of the severe pain, then you go able to do the exercise. Okay, so you know they left the exercise, say another take the painkiller for let it calm things down before you do the exercise, because the exercise now then really they help. You know, and the physio then can get with cause spinal manipulation, what they can they do. So take them pain medication, then 10 and day. And again, when you want to do certain activities, you can take the pain medication prior to that. Because sometimes we don't take the medication, you have to take the 30 minutes, 1 hour before you go into your system. So you don't help yourself, but then you keep your mind saying need for protect you back. No, wait, then the pain medication, you don't need for take her every day. You take her only when needed, because they get their own side effects as well. Okay, that's it.
Can I ask you a question, Dr. Ture?
Yeah, go on.
They're very good, them exercises, because I do them. Because my knees were locking.
Don't say don't late.
Right.
And the physio went through all these exercises with me, and they are very good and they do work.
So yeah, yes, indeed, they're really good exercises. I mean, people need to do them. Most people don't really want to do them religiously. You just want to do them once or twice, and they think the situation will be solved. But you have to do them regularly, and you take the painkillers prior to your exercises, and you take take the preventive advice they give in, basically. I think that's helped a lot.
Yeah, but they are brilliant and they do work.
Good.
Thank you very much, and thank you very much, Dr. Ture. Dr. Kamara, again, the last one for people and before we close.
I think Mr. Brahma is there. I don't know if you want to give him.
At the time I look at, we really don't have time.
I understand that.
Yeah, but no, it's they're interested.
Okay,
yeah, hello, good evening. Thanks very much for the presentation, Dr. Kamara, Dr. Ture, and all the team. This now Brahma. I ask a question regarding to the sciatica pain. And I get one my brother way do that surgery there na Ghana. You know, it's on back na salon, probably then at the program, but it came very late. So you never forget all the informations and way Dr. Kamara don't highlight before. Waiting at the risk of somebody where don't get that surgery there, because if you get problem in back, where actually the back now the problem there, but if you get problem at the foot, now the foot will be complain about. Say now later, we not be able to move, you know, before do anything, maybe even for need for stop work. Now later they notice say now the back now the problem there. So eventually the office fly I'm going to Ghana, then go do that surgery there. But waiting at the risk, say that kind of problem they will come back. And waiting at the thing way for like try for minimize then risk then they.
Now, I think this is simple. 1, prevention. 2, you know, the lumbar spine gets 5 bones, them like how Dr. Kamara say. It depends on the level where it be involved, where then go do that operation. Okay. Normally the level are 4, 5. Okay. If you not take prevention, the level can go up. It can be 2, 3. If you not take prevention, it can go even at the neck. So prevention is the key there. And again, like how you they explain and say the problem will be the foot. They try to explain similar things. Say so man will get things like foot, you go facing a claudication and everything. It can be a lumbar spine stenosis. Only when you lean forward, now they able to get relief in the pain. So yeah, and then conditioning they happen. So you have all in 33 or 37 and 33 bone the way Dr. Kamara mentioned, but so they're all there by level. So if people can get multi-level problems there. So it just need for take the protection, the exercise, and listen to your body. Listen to your body, and all the technique that Dr. Kamara explained. So when for lift things there, when not for lift things there, you need somebody for help. And you do them thing, and now the best thing and they can able forget, we will prevent and forget another operation. You get the other till with the operation, your complication back they come again. So I think that then the best advice we'll be able to give. I think.
And just for follow up, because like now the pain don't go for like the past 8 months where you come back from Ghana. but now they get like a tingling with the sole of him foot. So it's like now that's they complain every time, like a numbness at the foot.
Yeah.
Now the sole.
Yeah, I know it. I know it. They talk. Normally, that numbness, the level of the spine, we then get that operation part. The nerve there wouldn't come out through there. Sometimes it cannot irritate them, and then nerves then if you let them regenerate, it take long time. So that 1 millimeter growth per day. Now it take long time for that happen. So it goes still they get their numbness then they you know say then the ongoing. It get for look for other symptoms and before it thinks say something else happen. So then they can be something go live with them. But if a new symptom don't they come, then it for let the check again and make sure say it not get a recurrence of that because it can happen back. Sometimes it can be saying that the disc now just don't prolapse, then it try for good one. You say, and the disc get of different levels. I don't know if Dr. Kamara or anybody else get something else to add to that.
Well, I mean, you don't, answer them, appropriately as it were. So intended they just fine for let we understand. Say not to just the back. The possibility in a bone problem when they don't notice. You know what I mean? So you need to look at the bone profile for see whether you need to get this person on the bone tablets with for protector. That's in there. And of course, in any surgery, especially the bankrupt, when you open their muscle and pull that in the way they call laminectomy, and then certain the decompression and all that. So you find out, say, this thing can bleed. And it's how we call it bleeding can they. And then they say get to inside effect, inside that small space they went at the canal. So all that in there, obviously when I don't see the person, I don't know much about the person. I can't say much, but it does look as if they say now the nerve we would talk about, especially now the foot, that big toe there, now the level when L5 and S1, which the sit bone they begin from the lower back, that can cause that in there. But as I say, if new symptoms they occur, like I don't feel better soon now after 8 months, and then after 8 months, he actually developed new symptoms, them way similar to what they get before, then obviously need for be investigated, for trying to do something, maybe a scan for sure, whether a narrowing of the canal, like I talk, doctor can this stenosis, and it's another one, and you get for then assess them whether if you lean forward now you will feel better or not. So all that thing then you can't just do on the show. You need to actually see the person, talk to them, assess them and things. And another thing, this tuberculosis of the spine, a big thing where Bokum man they ignore and call them Pott's disease. All right. Yes. And it's important for let we know about it. So as I say, we can talk about this all day long, but you need for let we know what is it we talk about it with that thing. And maybe if you need for you can send questions to we, or if you want to talk to me personally directly, we can advise as best we can with it. But again, I don't know how much availability you get in a free talk. That is the question, We can talk about all fancy stuff, but if they're not did well, now make you see people that they go India, they go Ghana and things like that. But with the pray say one day we'll get them kind of dinner.
I got in power.
Thank you.
Thank you, sir.
So Dr. Kamara, what are the last word for people in place?
Yes, well, Mrs. Governor, now one back you get. Cherish them, protect them, preserve them. Otherwise, you not get the one that spare. There's no spare one more day. And remember, no suffer in silence. Well, Bɔdi, it better pass Gentri. So thank you very much to everybody, and God bless you all.
Thank you very much, Dr. Kamara, and thank you very much to everybody in the panel. Dr. Bell, I know see you there, but we don't run out of time now. Everybody will tune in. Plenty thank you. Well, Bɔdi Bεttεh pass Gentri. We will see you now again in 2 weeks. Thank you very much, and good night.
Bye. Nice to see you.
Thank you so much. Bye-bye.
Bye.